Correspondent Rich Edson tells us what's in it.
There are several Republican plans to replace Obamacare. Congressman Tom Price has written one of the most detailed.
Tom Price has been at the forefront not only of the repeal movement but also of the replace movement. Dr. Price introduced legislation for an alternative health insurance reform plan before the Affordable Care Act was passed.
His health care philosophy? Remove Obamacare, its rules for businesses, customers, and insurance companies. For those without insurance, a tax credit. The government would offer $1,200 a year for those between 18 and 35 to buy a private insurance plan, $2,100 between the ages of 35 and 50, and $3,000 for older Americans. Price's plan would also pay $900 a year for each child. It also gives states $3 billion over 3 years to help cover the sickest, most expensive patients, a sum Democrats claim is far too low. Price's proposal taxes employer-provided plans costing more than $20,000 per family and $8,000 an individual. It also allows Americans living in one state to buy insurance in another. As for the Obamacare requirement, insurance companies must offer everyone a plan, regardless of the person's health history. Price maintains it, with exceptions, and allows insurance companies to charge more if a customer goes uninsured at any point in the previous year and a half.
Price would give the same amount of money to everyone. And then instead of a lot of mandates, the health insurance industry would be free to compete to provide the most attractive package of benefits they could.
Democrats claim this plan harms Americans earning less money. It grants tax credits based on age, not income. Price's plan also repeals Obamacare's expansion of the government insurance program for the poor, Medicaid. Less government involvement, they say, means companies will offer shoddy insurance plans. Congressional Republicans are still working with the incoming administration on the mechanics of how they'll try to repeal Obamacare and whether to begin replacing it immediately. And Republicans still need to decide fundamental details, like how to pay for a new health care law. As was the case with passing Obamacare, arriving at a plan to replace it will consume significant time and focus and will likely feature a host of disagreements, even among Republicans. The president-elect has also made another health care personnel choice, picking consultant Seema Verma as administrator of the Centers for Medicare and Medicaid Services. Brett?
Big decisions ahead. Rich, thank you.